Today, that number is 205, which is a 39.4% increase just in the last 3 weeks of number of people hospitalized with COVID-19. And we know, based on South Carolina and national data, that the vast majority of people who are getting hospitalized and dying from COVID-19 are those who are not fully vaccinated. I cannot stress it enough. COVID-19 is now a vaccine preventable disease. South Carolinians don't need to continue to die and become hospitalized and sick from this disease. You can protect yourself and others. Just like vaccines have been overwhelmingly successful in saving populations from polio, tetanus, hepatitis, measles, whooping cough, the flu, and many other diseases, we have life-saving vaccines that protect us from this new disease widely available. The COVID-19 vaccines are without a doubt the best way to protect yourself from the virus and to protect your family and friends and to protect your community and end this pandemic once and for all. We are all longing to return to the way things were before COVID-19. And if you're fully vaccinated, you can do almost everything that you used to do. If you're not fully vaccinated, however, you can't return to normal safely. Wearing your mask and physical distancing are still your responsibility each and every day. We continue to see reports of young people attending summer camps where incredible COVID-19 outbreaks are occurring, mostly because the majority of these young people are not vaccinated. The Illinois Department of Public Health recently announced an outbreak of 85 cases among young people at a summer camp. 125 campers and adults have tested positive after a summer camp in Texas, and 100 cases have been reported among those who attended a summer camp in Kentucky. Unvaccinated people are fueling the pandemic, especially unvaccinated young people. If you want to get back to normal, if you want to stay healthy and help save the lives of other people, you'll get fully vaccinated when you're eligible. Please don't wait to get your shots if you are eligible. Our current situation is tipping in the wrong direction. We can't let the virus and its variants grow stronger. Getting vaccinated is how we win. Thank you.
And thank you, Dr. Traxler, for that update. Here's our first submitted question. Given that 19 to 24-year-olds are the least vaccinated group, is DHEC concerned about the upcoming fall semester when thousands of students will return to South Carolina? Are any new plans in the works to reach this age group, such as partnering with universities to set up vaccination sites?
So we are very concerned that close contact among unvaccinated people is resulting in the disease spread. We're seeing increasing numbers of young adults becoming ill even and requiring hospitalization. We're seeing outbreaks among young adults in summer camps across the country, mostly involving large numbers of unvaccinated individuals. Colleges, universities, and other higher education schools are implementing their own policies in regard to COVID-19 vaccinations for students and faculty. DHEC does provide evidence-based guidance in the development of these plans whenever requested. We are also continuing to share the latest recommendations and guidelines and guidance with the South Carolina Commission on Higher Education. Many colleges and universities are partnering with the local vaccine providers to hold vaccination clinics. And so students and parents should look for that clinic information from their schools. Other schools, colleges, and universities that aren't holding on-site clinic are referring students and faculty to our DHEC Vax Locator map, where you can find where the free COVID-19 vaccines are near you. There's an abundance of vaccine that's available at providers all throughout the state.
So what is the number of Delta variant cases currently in South Carolina?
Sure. We are currently reporting out 12 instances of the Delta variant. As we noted before, we know that there are more cases of the variant in our state since only a sample of positive COVID-19 specimens are sequenced to identify any variants. And data are showing that the proportion of Delta variants identified is increasing rapidly. What is important to remember, though, about the Delta variant is that the current public health recommendations don't change with it. Getting vaccinated as soon as possible is the best way to protect against the virus and all of the variants, including the Delta one. And if you aren't fully vaccinated yet, you need to be wearing a mask in public and refraining from close contact with others.
So this journalist says that they heard something this morning about a new variant found in South Carolina called Lambda. Maybe a report from MUSC. Is there any more information on this particular variant that you can share?
Certainly. So yes, MUSC recently reported that it identified a case of the Lambda variant. There are a number of variants, with any combinations of mutations of the SARS-CoV-2 virus, and the Lambda variant or strain is just one of them. Currently, the Lambda variant is not being tracked by the CDC as what they would call a variant of interest or a variant of concern. And so we don't track every case of every variant, again, because there would be just dozens and dozens, if not more. And we currently aren't tracking the Lambda variant in South Carolina. Because there's no indication at this time that it poses any more threat than the original virus, or the majority of the original virus's variants.
With an influx of visitors to South Carolina, the Myrtle Beach area specifically, during the summer and over the July 4th weekend, how concerned is DHEC with the potential increased spread of COVID-19 since we don't know how many visitors are vaccinated? And then the follow-up question is, how does the Delta variant fit into this?
So, I would say that DHEC is concerned about the increasing spread of COVID-19 everywhere in our state, including along our coastal areas, because anytime we're seeing places where you have large groups of people getting together, particularly when they're in closer contact, then we know that puts them at risk if they're not fully vaccinated for this virus to be spreading around. We also know that still we are only at that 43% vaccination rate. And again, we don't know, as they point out, the vaccinations of visitors, but whether it's residents or visitors, anybody that's unvaccinated and in close contact can help contribute to the spread of the virus. So that's why it's so important to get vaccinated first and foremost. But if you're not fully vaccinated, to wear a mask and make sure you keep your distance regardless of where you are located or are visiting.
Okay, I don't know.
And I'm starting to hear some feedback. Okay, good. You're hearing it too. So let me go ahead and mute a few folks as well, just so we can make sure that everyone can hear the questions and the answers. Okay. How steep is the rise in cases in the PD, and are there more hospitalizations in the PD region?
So we are, as I said, seeing an increase in cases and in hospitalizations statewide. And if you want more information about a county or region specific that I might not know off the top of my head, I recommend looking at the DHEC online dashboards for the last several weeks. Those get into very specific trends and data.
And Dr. Traxler, do you know if the increase in cases is just impacting unvaccinated people?
So we reported out in the last couple of weeks about our analysis that we did on the data from the first 2 weeks of June, that was showing what high rates of cases were among unvaccinated people. And we, have not seen, I don't have the specific number readily available for more recently, but we are not seeing a change in that trend. We are seeing that the vast majority of people who are getting diagnosed with COVID-19 are unvaccinated. It is not 100%, but it is certainly an overwhelming majority.
Do you think that the door-to-door vaccination promotion, in other words, providing information about COVID-19 vaccination, is counterproductive? Do you agree with the governor's position on door-to-door vaccine promotion?
I think different people feel different ways about being approached in person in their home. Some people may be welcoming to that in-person connection and one-on-one answering of questions, and other people may be rightfully bothered or even frightened or concerned. We did not have door-to-door promotion built into our outreach plan. We feel that for those who are on the fence about receiving their vaccines, Hearing from people that they know and trust instead of DHEC or the government will help them realize the benefits of getting their shots and lead to them taking action to do so. We're continuing to share information with the community leaders, local businesses, faith groups, local medical providers, and others so that they can relay that information to the people that they already have established relationships and trust with. And these people know them and trust them. Those personal conversations, again, between people that already know each other, we believe are very important at this point.
When can we expect the vaccines to receive full FDA approval, not just emergency approval? Do you think that would help ease vaccine hesitancy among some groups?
I do not have any inside information on when the vaccines will get their full approval. I'd have to defer to the FDA on that at a federal level. Though I know that Pfizer has, for their first age cohort, the adults, has submitted their application, but I don't know a timeline, even an estimated one, for getting that approval. It may help improve vaccine hesitancy, but I do not think it's the only answer to overcoming any hesitancy.
How is the Delta variant affecting children? And has South Carolina seen more children cases tied to the Delta variant?
So South Carolina is not seeing more children cases in children that have the Delta variant as compared to adult cases with this variant. Of those 12 COVID-19 Delta variant cases that I referenced earlier, only one was less than 18 years of age.
Is there a way for local hospitals to ask DHEC to analyze COVID tests for specific variants? For example, if a doctor suspects a certain patient has the Delta variant, are they able to send a specific sample for testing, or is it still random to tell the spread of certain variants?
So no, people cannot request sequencing or testing basically for looking for variants of specific specimens. No one is able to do that. It is a random sample that is being sequenced and tested for variants. And that's because the purpose of this sequencing is for surveillance. It's not for individual diagnosis or to base individual treatment decisions on. It is for surveillance for public health leaders and other leaders in jurisdictions to track these variants and see how the trends are going. The management of a patient with COVID-19 positive specimen, whether it's the Delta variant or not, is not changed at this point. And everybody needs to be taking the same precautions, especially getting vaccinated, to protect themselves from the Delta variant and any other variant out there.
How concerned should South Carolina residents be about the spike in RSV cases? Do you know how many cases of RSV have been reported in South Carolina so far this year?
So RSV, the respiratory syncytial virus, is not a reportable condition, explicitly in South Carolina. So we don't have data at DHEC regarding the number of individual cases of RSV in the state. However, outbreaks of all types, including more minor illnesses, and including outbreaks caused by RSV, are reportable. DHEC has seen several RSV outbreaks reported over the past several weeks. RSV is a common respiratory virus, and almost all children have had an RSV infection by their second birthday. It usually causes a mild cold-like symptoms, but it can be serious, particularly for infants and older adults. It's the most common cause of what we call bronchiolitis, which is just the fancy medical word for inflammation in the small airways in the lungs, and of pneumonia, which is, of course, the larger infections in the lungs, in children that are less than 1 year old in the United States. And so it is important for parents to watch their child for signs of illness, and contact their doctor right away if their child's having any difficulty breathing, is not drinking enough fluids, or experiences any kind of worsening of symptoms.
And has South Carolina seen any cases of Guillain-Barré tied to the J&J vaccine? And should people who have already received this vaccine be concerned?
So every year in the United States, about 3 to 6,000 estimated people develop Guillain-Barré syndrome, GBS. Most people fully recover from this disorder. Vaccine providers report cases of GBS following a patient having received the J&J vaccine. Those reports go into that national database that has been talked about before. That's called the Vaccine Adverse Event Reporting System, VAERS. This is a national database, and so DHEC does not have the data to know if cases of GBS following receipt of the J&J or Janssen vaccine have been reported in any South Carolina residents. Although the evidence that's available suggests that there is an association between this vaccine and the increased risk of GBS, there's not enough evidence to prove that it is a causal relationship. And it's important to note also that no similar signal or uptick in GBS cases has been identified with the Moderna or Pfizer-BioNTech vaccines. Also, it's really important to note that the FDA has evaluated all of the available data and information for the Janssen COVID-19 vaccine and continues to find that the known and potential benefits clearly outweigh the known and potential risks of getting this vaccine. Any vaccine recipients, including ones from the Janssen vaccine, should seek medical attention right away if they get any of the following symptoms after getting the vaccine, particularly if they did receive the Janssen one. Weakness or tingling sensations, especially in the extremities, the arms and legs, that's worsening and spreading to other parts of the body. Difficulty walking, difficulty with facial movements, including speaking, chewing, or swallowing. Double vision or not being able to move your eyes, or difficulty with bladder control or bowel function.
Does the Delta variant and the potential emergence of Delta Plus change or impact DHEC guidance on masks and distancing in schools?
So the CDC just released its school recommendations for the 2021-2022 school year last Friday. We are currently reviewing those recommendations, and we're using those to draft our guidance for schools for the upcoming year. The public health recommendations for protecting yourself from COVID-19 don't change because of the Delta variant. There's nothing additional beyond the existing recommendations that you can do to protect yourself from it. Getting fully vaccinated as soon as possible, as soon as you are eligible, is the best way to protect against that Delta variant and all other variants that exist of the COVID-19 virus. And if you aren't fully vaccinated yet, again, you need to wear a mask in public and avoid close contact with others. Then we continue to strongly encourage everyone who's 12 years and older to get vaccinated now so that you have time to build up that immunity before the start of school, or at least early on in the school year.
How common is Delta Plus in South Carolina?
At this time, no cases of Delta Plus have been reported to DHEC.
Key indicators show that the new COVID cases are increasing in South Carolina. What is driving this increase? Is this already a 4th of July spike or the Delta variant? And can we expect new case rates to continue to rise?
So as I noted earlier, we've had that 3-week increase in cases, which takes us back to before the 4th of July holiday, though we have seen an increasing rate of increase in those case counts from week to week. This is likely multifactorial. It is going to be near impossible to pin it just on one thing, such as the 4th of July holiday weekend, or the increasing spread of the Delta variant. But one thing that is likely driving a lot of it is the percentage of unvaccinated people that are in South Carolina and are vulnerable to infection from COVID-19.
Hospitalization rates are plateauing, if not slightly increasing. Are hospitals considering rebuilding expanded COVID units?
I am not aware of specific details as to how certain hospitals are adjusting their operations, but I don't have any doubt that our hospitals have plans to be ready to accommodate an influx of COVID-19 patients if we were to experience a resurgence or another wave in our state. All hospitals have surge plans and other preparations in place for how to accommodate and safely care for an increase in patients. Those surge plans were put to use over the past year as the pandemic unfolded. DHEC also has agreements with the South Carolina Hospital Association to work cooperatively in identifying additional bed space in other hospitals for potential patient transfer, the exchange of supplies, equipment, and staff if shortages should occur. But again, I want to stress that we can avoid having to put any of these plans in place and having to do any of these surge activities if we stop the increase in cases, and that's mostly done by getting fully vaccinated against COVID-19.
All right, Dr. Traxler, we've got two more questions, and then we're going to turn it over to live Q&A.
Okay.
I've heard people calling the Delta variant COVID-21. Why would that be? Is this variant so different from the original strain we first called COVID-19?
I have not heard that, though I would assume that that is jokingly being used because the Delta variant has emerged for the most part in the world in 2021, though I believe it was first identified actually at the very, very end of 2020. And of course, the number that comes after COVID is representative of the year that it was first diagnosed or first identified as infecting people. I have, like I said, I'm not aware of any plans to give it its entirely, unique name of COVID-21. There are mutations, a number of mutations in the Delta variant, just like there are in many variants, though, compared to that original strain. So I don't know that you can say that it has so many more mutations that it deserves or needs its own unique name, at least in comparison to some other variants too.
All right. Thank you, Dr. Traxler. Judy, you've got a question?
Hi, yes, I do. Thanks so much. Good afternoon, everybody. Dr. Traxler, I wanted to follow up on the information you shared about some of the camps where we have seen outbreaks. How concerned are you? I know you're still working on drafting your school guidance, but in light of what we're seeing in the summer, presumably in a lot of outdoor settings, how concerned are you about elementary school settings in South Carolina, particularly with the limits that have been put on what districts can require in terms of masks for children who are younger than 12, and we have no idea yet when they'll be vaccinated or have the opportunity to be vaccinated?
So I am concerned about the spread of the virus in any groups of people that are not fully vaccinated, be it because they have not elected to get vaccinated or because they're not eligible yet. So I will say with the camps, you pointed out some of the key things being that it's in the summer and most of them are outdoors. However, most of them also have very congregate living settings, which we don't see with schools. We see kids all in one room in bunk beds in very close, tight quarters, like dorm rooms, but multiplied times several for camps often. And so that certainly is a very large opportunity for what would be considered close contact, prolonged close contact. However, this could be, and I don't want it to be a foreshadowing of what could be seen with schools. And that's why I think it is important for everyone to, again, if we can decrease that amount of virus that's spreading in general in the community by people getting vaccinated who are eligible, then that's that much less virus that could potentially be spread amongst children who aren't old enough to get vaccinated yet. And so that'll decrease that risk. And so I don't know that this is exactly what will happen with schools, but it certainly is a warning, I think, to everyone for multiple reasons for why we need to get eligible people vaccinated.
Danny Lynn, you've got a question?
Yeah, Dr. Traxler, I don't even know if you are old enough, shall we say, to remember this. Guillain-Barré is not new as a side effect. Back in the 70s, swine flu vaccinations. and people survived it.
Yes.
Is that the advice for people worried now?
So-
We have history with GBS. We know what it is. We've seen it for another virus vaccine. Not to downplay the impact, but people survived it.
Correct. The Guillain-Barré syndrome was first really identified and named back in the late 1970s with the swine flu vaccine, as you pointed out, and with cases being identified there. We also have seen it at times, some years with the flu vaccine. So it does have a history with some other viral vaccines. But again, like you said, I don't want to downplay it. It can have lasting impacts. It can rarely, but it can cause death. The important thing to remember here is that number one, the vast majority of people do recover fully. And number two, the extremely low incidence rate that we still are seeing of it. The FDA reported out that they had tracked 100 cases out of 12.8 million doses of the Janssen COVID-19 vaccine that were given in the United States. So that is an extremely low incidence rate when you look at how many vaccines have been given.
Vanessa?
Hi, good afternoon, and hope you're well. Thank you for taking my question. I wanted to follow up on something you were talking about before about the, I guess, the inability to request that your sample be sequenced to see if you had Delta. I actually have a colleague who was very public about this, but he was a breakthrough case fairly recently, and he had talked about just being curious about whether he had Delta or whether it was just the original COVID. Is there any way for someone to find out whether they had Delta, whether it be maybe like an antibody test or something else?
No, it would need to be the sequencing, that WGS, that whole genome sequencing is the only test that would differentiate that whether a person had the Delta variant versus another variant of the COVID-19 virus. And I am not aware of any place or any entity through which you can request, or even that a doctor can request a specific patient to be sequenced and identified.
Mike?
Thank you. It seems through our questions and in the community that Delta and its variants are one of, if not the most concerning part. I've asked before, and DHEC has not been able to say how many COVID tests that are positive go for surveillance. I've seen national figures put it at about 1.6%. So when you say that we've had one case of Delta in children, it's likely that we've had dozens or even 100. It seems to me that we're kind of operating in the blind, not knowing this. Is there a way to increase the amount of surveillance? Is it a matter of capacity, money, regulations? Why can't we say what the number of surveillance cases are?
Sure. And so those are two, I would say, very good different questions, though, in terms of why we can't say what the number of cases or the number of tests that are done for surveillance is because we just do not have that information, because there is a lot of sequencing going on. There are many, many labs across the state and country that are doing the whole genome sequencing now, which is great and is a significant increase from earlier on in the pandemic. But what are reportable to DHEC are ones that are identified as variants, and so we don't have visibility on the number of normal sequences that are performed, so to say. In addition, when you're asking what the barriers are to performing more whole genome sequencing, I will say that it has significantly been scaled up, the whole genome sequencing, both or I'd say all in our public health lab at DHEC in the state of South Carolina and across the country, and even across the world, since early on in the pandemic, even before the first variants were identified. And so work continues to be done. There has been more grant funding coming down through the federal government and the CDC to states and labs, or there will be here in the near future, that is dedicated to whole genome sequencing. So it continues to be scaled up, but just as it has been going on already. So I don't think there's a specific barrier that exists or that's having to be overcome. Again, the goal of surveillance is not to sequence every single positive test. It is to make sure that we are getting a representative sample. So not just looking at the number that are being performed, but making sure that they're representative of the positive specimens in the state from all different angles. And then looking at the proportion of variance within that sample.
And so thanks, Mike. We're a few minutes over, but we do have time. We're going to take 2 more questions. I'm going to go to Morgan first, and then Judy, I'm going to let you bring it home. So Morgan, go ahead.
Thank you, Christy. Hey, Dr. Traxler. I was wondering how effective you think the vaccines are against the Delta variant, and how can just bring again that point home of why it's important to get that vaccine.
Sure. So we have seen data. Every couple of days, I see more data coming out, a new study, more follow-up data that shows that the currently available COVID-19 vaccines are effective against the Delta variant, especially when somebody's considered what we consider fully vaccinated. So for Janssen, it just means 2 weeks after that 1 dose. For Moderna or Pfizer, it's 2 weeks after that second dose. There may be some decreased for the vaccines that are the 2-dose series. There may be some decrease in its protective actions with just 1 dose compared to other variants, but it is still extremely protective and effective if you get the full vaccine series. In addition, we know that where these mutations are on the Delta variant along that genome are not in places that are likely to make it so, to have made it so that those vaccines would not be effective against the variant. So even before we've had as much data as we do now, it was not felt scientifically that the vaccines would have, a significant decrease in their effectiveness.
And Ms. Gadsden, you've got the last question for today's briefing. Go ahead and ask it.
Chrissy, thank you so much. And Dr. Traxler, thank you as well. I wanted to get back to schools that we mentioned. I know we're still about 5 to 6 weeks out from school starting. Before the end of the school year, in some states, they were offering vaccines on site at schools for kids who were eligible. Is DHEC looking at that, considering that, have any plans in the works to maybe provide that at schools when South Carolina schools are back in session?
So DHEC has and is looking at all of the different options to get vaccines out to people, to improve access for all populations. And one thing is we continue to work through also all of our vaccine provider partners, which we have, as you all are well aware, many different types of now, everything from individual provider offices to pharmacies to hospitals. And a lot of these entities, especially the larger ones such as hospitals, even have mobile units or are going and setting up, as you noted, clinics at different locations. And so we continue to encourage our partners to work with local entities, including schools, including colleges and universities, to help make that vaccine available to anyone who wants it in a very easy to access fashion.
In closing, I'd like to thank you, Dr. Traxler, for joining us for today's briefing, and also our fabulous journalists all across the state. We appreciate your continued coverage of our ongoing, not quite yet over, pandemic. So we will join you again next Wednesday, and today's briefing is now concluded. Thank you all.